Hey, Dr. Prem, I'm going to read you some patient excuses that I have taken from the internet, and I'm pretty sure you have heard of them on a daily basis as well. All right, the first one, I don't need a checkup, I feel fine.
This is something I hear almost all the time. Okay, I think this often comes in with people who have what we call the silent diseases, things like diabetes, high blood pressure, high cholesterol. It often takes a lot of convincing for them to understand that these conditions are not okay. Often I see someone, and in fact today I was talking to one of my patients about the blood pressure reading. Say, but I feel fine. What's wrong with it? I don't feel like my blood pressure is high. The thing is, our body doesn't always sense everything. We've only got about 6 to 7 senses: sense, touch, taste, and so on. We're not able to sense everything in our body. Sometimes we're able to feel big changes. For example, if your pressure is going to shoot up extremely high, extremely low, suddenly you might notice that. But much like the story of the frog in the boiling pot of water, small changes are not going to be appreciated by you. So just because you feel okay or you don't sense your pressure is high doesn't necessarily mean you're okay. It may mean that the condition is building up, and regardless of whether or not you are feeling it, the damage is happening. Our job with dealing with these silent conditions is to pick them up early and prevent major complications from happening, rather than having to deal with a heart attack or stroke 10 years down the line. We want to start treating you now so that you remain healthy and enjoy the golden years of your life.
Second excuse, I Google my symptoms, so I don't need to see a doctor.
Actually, if anything, I think if someone Googles his symptoms, they come in with more worries than less. More often than not, the availability of the internet and medical knowledge and shared experiences from other people online can help illuminate some problems. However, they often tend to be very impartial. They do not take the context of what you're dealing with. For example, a chest pain could indicate a heart attack, or it could indicate that you're having anxiety, a panic attack, or simply just having some muscular strain. We need to be able to assess and see what's going on to figure out whether or not you need to see a doctor right away at the emergency room, or whether you should just take some medications and let it go away. So while Google is a great way to help yourself understand more about your condition, I would still seek the advice of someone you trust, a licensed medical practitioner, to give you a better insight into what's going on.
Okay, third one, I forgot to take my meds.
Very, very common. I think often this comes hand in hand with the I don't feel anything, I feel fine. Often we have this sort of thought that whenever we take a medication for something, it's going to change something. For example, you take a medicine for the fever goes away, we feel better. However, for silent conditions, as I mentioned, we don't often feel the symptoms. We don't feel that the blood sugars are high. We don't feel the blood pressure is high. We don't feel our blood cholesterol. We're not equipped with those senses. So when you take these medications, you don't feel any change. Unless you're going to religiously measure your blood pressure, you're religiously going to measure your cholesterol, you're going to measure your sugars, you may not notice any change at all. Sometimes there may be minor changes. You can attribute to anything, just having a good day. For example, your blood sugars are well controlled, you feel less tired, less fatigued. You might be just saying, hey, maybe I'm doing something right. Maybe things have turned around. I'm feeling less stressed. That's the reason why. Medication compliance is quite important, particularly if you've got a severe condition like diabetes or high blood pressure. So if you need something to remind yourself to take these medications, okay, pill organizers work well. Nowadays, nobody is without access to your phone. Just set a reminder, okay, every day, same time, every day, take your medications, okay? Or if you've got someone, who's in your life who cares for you, let them know so they can help you out to organize your medications for you.
Excuse 4, I don't have time to exercise.
Okay, I'm guilty of that too, unfortunately. Often when it comes to dealing with chronic health issues, okay, we need to start doing more to take care of ourselves. We need to start prioritizing ourselves, right? We often tell ourselves, I've got this to do, I've got that to do, I'm busy, because all of this is happening. My work is important, my family is important, my children are important. None of that is important if you are not around. If you don't start taking those steps to help yourself, to dedicate an extra 5-10 minutes in your day just to do something like a simple walk or stretch, or follow a YouTube tutorial on how to do some yoga or HIIT exercises. So invest in yourself. You've invested so much in all those around you, your work, your life, your family, your loved ones. Start taking some time, start taking some effort to take care of yourself too, because you want to be there to enjoy the benefits of your labor.
Alright, last one, I thought it would go away on its own.
Okay, sometimes we have that. Some patients are deep in denial. They've had this nagging pain in the left side of the chest. And anytime you say that to a doctor, red flags go up. You're like, are we dealing with something with the heart? And I can't tell you the number of patients who walked in, 4 days, 5 days later after a heart attack because they thought it'd go away. Yes, some things can clear up. However, if it is a significant concern, if you've had experienced any sort of chest pain, difficulty breathing, confusion, weakness in an arm or leg, facial asymmetry, anything that could point to a major event like a heart attack or a stroke or anything similar, all right, go and talk to your doctor. Even if it's nothing, at least you go home knowing that it's nothing, rather than thinking and letting it be what if and festering in the back of your head.
Okay, Ken, that's all. Thank you, doctor.